National Foundation for Infectious Diseases www.nfid.org Flu 65 In recognition of National Influenza Vaccination Week, the National Foundation for Infectious Diseases (NFID) has been actively promoting the importance of annual influenza vaccination. The following post by NFID Medical Director William Schaffner, MD, was originally published on kevinmd.com. When a patient is diagnosed with a chronic disease, like diabetes or hypertension, physicians don't merely suggest medications to lower blood sugar or blood pressure, they insist that patients take medications to protect their health. However, the recommendation to get an annual influenza flu shot to prevent flu is often not as emphatic. Research has shown that patients are much more likely to get a flu shot when it is offered or recommended by a healthcare professional. National Influenza Vaccination Week (NIVW), an annual event created by the Centers for Disease Control and Prevention (CDC), is a great time for healthcare professionals to highlight the importance of annual flu vaccination for everyone aged 6 months and older. Unfortunately, it seems that not everyone has gotten the message about flu vaccines, and many vulnerable individuals remain unprotected. NIVW also reminds healthcare professionals to strongly recommend flu shots to their patients, especially those at high risk, including adults aged 65 years and older. The flu can be serious for everyone, but for adults aged 65 years and older, flu doesn't just mean a few days at home in bed, it could mean a hospital stay, lifelong complications, and in some cases, even death. In the U.S., older adults account for more than half of all flu-related hospitalizations and 85% of flu-related deaths. Despite the risks, vaccination rates among older adults have remained stagnant for the past 5 years. For adults aged 65 years and older, there are 2 safe and effective vaccines, Hydus and adjuvanted, that are specifically designed to overcome the effects of an aging immune system. To protect our patients against flu-related complications and provide them with the best chance of a swift recovery, we must give them explicit prescriptions and instructions. With my patients, I like to tell them, it's winter time and that means it's time for your flu vaccine. You'll receive it on the way out. Providing them with a strong recommendation as well as easy and immediate access to the vaccine helps ensure that they recognize the importance of getting an annual flu vaccine. In fact, if I do get pushback from patients, I tell them that I am vaccinated, my family is vaccinated, everyone who works in this office is vaccinated, and we want all of our patients to be protected against flu by being vaccinated. All healthcare professionals, including primary care and specialty care physicians, as well as caregivers, family members, and friends, need to strongly insist on annual flu vaccination to the older adults in their S. A strong recommendation, and sometimes even a written prescription, is essential to ensuring that those aged 65 years and older are protected from the flu each and every season. Vaccines are the most basic tool for preventive care, and as such we should all be vaccine insisters. During NIVW, I encourage you to view a new resource developed to assist in discussing the importance of an annual flu vaccination with older adult patients. The Care for Older Adults Care About Flu Toolkit by NFID includes resources to help you make a strong influenza vaccine recommendation and ensure that your older adult patients get the protection against influenza that they deserve. The toolkit includes a downloadable fact sheet on the risks of flu in older adults, an infographic to illustrate the unique risks and potential complications of flu among this population, customizable scripts to help guide conversations with patients, and a 30-second video about the importance of annual flu vaccination. These resources can help prepare healthcare professionals have important conversations with their older adult patients and acknowledge the importance of insisting that a flu shot be an annual tradition. Together, we can help protect this important and vulnerable population. Download